Hi there, I'm Mark Owen Cooper, 50-year medical student. We're currently at the National Rural Health Conference at TSB Arena in Wellington, and today I'm talking to Victoria Catherwood about why she's here at the conference. So here, welcome.
Thanks. So I'm at the conference because I was asked to speak as the student keynote speaker at the breakfast tomorrow. I have been asked to speak because I'm currently creating a resource documentary targeted at New Zealand doctors discussing cannabis as a medicine. So we hope to highlight the evidence-based research benefits and harms, as well as talking about the legal implications in New Zealand.
Right, okay. So it's obviously a very topical subject at the moment. So how do you think that the medical field has been kind of receptive of this so far?
From my personal experience, since we went live with the crowdfunding to raise the funds for the documentary, the response from doctors has been overwhelming. I've had doctors contacting me, want to have Skypes, phone meetings, some of them wanting me to go to their houses to discuss options and what their experiences have been with patients. I haven't had one doctor or medical student yet has said anything negative about cannabis as a medicine and educating about it in New Zealand. So the response has been pretty positive. However, in the public view, it's difficult for a lot of these doctors to speak out because cannabis is illegal currently. It means that they are fearful for repercussions if they were to speak out. So the response has been pretty overwhelming, but from the public point of view, not so much.
And I guess a lot of it's kind of an educational thing in the fact that a lot of people don't really know the benefits of it and what it can do, and it's kind of getting that information out there to help provide information.
Yeah, totally. So at medical school, there's currently no official education about cannabis as a medicine. We do get educated about cannabis harms like misuse and abuse, and of course that's something someone should always consider, but we're talking about sick individuals who a lot of them are terminal, and drug use and abuse isn't so much as a problem for them because they're already on levels of, say for example, opiates that would, if they weren't sick, would classify them as misuse and abuses. So these people, because they're medically using it, that's not so much of an issue. So we think that educating about the benefits and kind of discussing those harms as well is beneficial because it'll help people to understand that there is peer-reviewed evidence out there and it's difficult to find, and we just want to clarify what works for what and how these patients are using it and what's legal.
Yeah. So it's definitely a hot topic at the moment.
Yeah, absolutely.
And it'll be good to see kind of what's happening in the future and how it progresses, and hopefully the documentary will be great.
Yeah, cool.
I believe there's a Give a Little page that you're using for fundraising.
We had a Pledge Me crowdfunding page. We currently aren't raising money through that anymore because it's quite time intensive, and being a fifth year rural medical student, I don't have a lot of time to do that anymore, but over summer I did. So we need a little bit more money. So we've currently raised $15,000. We need a little bit more than we initially thought because the budgets always go up. So I'm currently working to sort of fundraise the extra $8,000, and hopefully we can get that to make this documentary possible.
Right. So I guess it's one of those watch this space things.
Yeah, absolutely. I mean, watch this space because cannabis as a medicine is already legal in New Zealand. So there's Sativex, which is a pharmaceutical cannabinoid that you can get through prescription from your specialist. It's quite difficult to get, and it takes about 3 weeks from application to receiving it, and it costs about $1,000 a month. Right. So that's legal, and also bringing whole cannabis through customs is also legal as long as you've got your prescription and the original bottle that it comes in. So doctors need to know this because cannabis can interact with other medications that they're on, such as warfarin, Voltaren and epileptic drugs, lots of other drugs that it can interfere with. So it's important that we educate these doctors and you know they have the right informed conversations with patients so that we can minimise the harms.
Right. So yeah, it's a very interesting topic that we'll find more out tomorrow at the student session.
Yeah, absolutely.
So thank you very much for coming and talking with us.
Thanks, Mark.
And no worries.
Awesome.